Today we're here with Melissa, and she's feeling a little sad. Why are you feeling sad, May?
I'm not feeling at my best.
But you look so pretty. I mean, she really looks pretty. So we're just going to do a little bit of tweaking to May. This Saturday or Friday, we're going to do a little bit of lipo here. She's got a new chin, and we get her this little thing right there. So your face is really pretty. We're going to do a little bit of volumizing the cheek, a little bit in the jawline, and maybe just a little bit in the nasolabial folds. Does that all sound good to you?
Yes.
Does that sound exciting?
That sounds very
I
exciting.
do that face that you do. Oh, we have to fix that. Because look at how pretty she is, but she looks mad. We don't want anyone to know that you can make that face ever again. All right, so we're going to be using Define. I love Define. It stays in place, it's long lasting, it's a year-long filler, and it's rubbery, so it's beautiful. It moves with your face. It's called Expression Technology, which I think is a really fun word. So here we go. And now, what's the one side effect you might get, May?
Bruising.
Bruising.
I bruise all the time.
Well, some people don't know that you can get a bruise from getting injections, and some people don't know you can get a scar from doing a cancer surgery. But those are things that are commonly occurring. Now, she's got these beautiful cheeks, so we don't want to overfill her because she's still young and beautiful. I love it when young and beautiful people want to do stuff. There's hope for everybody when you know that even beautiful people are insecure. Now we're just going to do a little bit along the jawline. And this is just to define the jaw a little bit. And she's got a little bit of fullness here, which at some point will be a problem, and we'll have to do something like Kybella. And Selena, do you mind getting that little blood tear right there?
There you go. Sorry,
Okay.
I took ibuprofen
So-
yesterday.
We're going to do some more up here, just to lift her cheek. Now, everybody's face is different, and so sometimes I can do this little bit of filler up on the sides, and on some people it works, and some people it looks like they have fat cheeks. But May just was born with these natural, full, beautiful cheeks, so we can actually go with what God gave her. And one thing I like is when people bring a picture of themselves when they felt like they looked their best, because that way we can sort of try to recreate it. And we have a target to move to work towards. I've known May for, I don't know, 14 years, May? Is it 14 years?
Yeah.
So I've seen her face, so I know her face. I've studied her face. Here, you see we're just getting a little bit more volume. We don't want it to be ridiculous or anything. And how's the pain, May?
It's not bad at all.
Good. Are you just saying that for the camera, or is that real?
No, that's true. I did a little bit of numbing cream right beforehand.
Good. I love that. And May has a little bit in her lips, and she has this product called Kiss, which I think is really nice because it's a little bit dewy, and so it doesn't look fake or anything like that. It just gave her a little bit of a plump. And they're very kissable. Get it? So we're just softening up those lines. I don't want them to disappear, but I do want them to soften up. Do the same thing over here. Just, I like to have a little separation between the cheek and the upper lip. And the reason for that is the face is full of cosmetic units. And this is one cosmetic unit around the mouth. The nose has multiple cosmetic units. The cheek is one cosmetic unit. So we want to just keep those cosmetic units because that's what makes us look attractive. So she's got a little dent here from her those chin fillers. We'll put a little bit in there. And to me, it's always about looking natural. We don't want people to go, oh, May, you did your cheeks. Or May, you did your lips. Or May, you did this or that. It's our secret, right, May? Do you tell people when you do stuff? Like, does your husband know you do this?
Yeah.
He knows?
He knows. I told him this is how he met me, so he embraces it.
He does? Okay.
He loves it. He says it does look natural.
Good. Okay, so we're going to just do that today because I think it looks really cute. Let me just get a little water on here so I can show you what it looks like. And I just think it's so nice. Now, some people like to, I like to do the serial punctures. You can see I did multiple injections, but The fat cells are like little teeny raisins. They're just irregular shaped pieces of fat cells in the body. And so I do like to do little serial injections so we can sort of mirror that the way the anatomy is. Some people will do linear threading, and I never think it looks as good. And so this is the way I do it. And unfortunately, it does lead to a little bit more bruising in some people, but May really didn't have a lot of bruising. So let me show you what we did, May. I have a mirror, I'll show you what we did. I don't have a mirror. So can we get,
Let me go
can
grab
somebody grab a mirror? Okay, now next thing we're gonna do is we've got a little disc port, and I always like to do the chin because you can get cellulite chin. So here we go with a little pucker. See that pucker? Do it again. See that puckering? Oh, I don't like that at all. It makes your skin look wrinkly and like a golf ball. Okay, scrunch your nose down really hard. So we're gonna get rid of these bunnies. This, if we don't take care of these, at some point, they can stick, and we don't like that at all. And then see, she's got just a little bit. She looks really mad right now. And May has this really soft voice, so when she's mad, it gets higher and squeakier. Raise your eyebrows up high. And then we're just gonna do a little bit in here to soften these up. And she's in a good place in her life because they're still dynamic wrinkles, which means they're only there when she furrows. When she's not furrowing, they're not there. Okay, that's everything. Now you can see you get a little pick me up, and how long was this? Do we have any idea?
6 minutes.
6 minutes. You can be all freshened up in 6 minutes and look like a new woman.
With my spirits.
Yes. Okay. So go ahead and take a look at me.
Oh,
So I
wow.
gave you just a little bit of cheek here, a little bit of cheek here. We soften these lines here and here. Just straighten this out a little bit and just smooth out the jawline. So that's a 6 minute refreshener. Now the Botox or Dysport, excuse me, is going to take approximately 3 days before you'll start to see effects. It takes 2 weeks before you see the final results. Bruising that she's going to get a little bit of is going to take 1 to 2 weeks to heal. And for you, tinted sunscreen may even cover it. But if you have any questions, please let us know. We're here 7 days a week, and please like us on Facebook, Instagram, and YouTube if you can. Thank you so much for tuning in.
Bye.